Gription. So I can't see any advantage of, apart from the very select cases that we discussed in the main hall, I can't see any advantage of TM over Gription. So Gription is as good as TM. So it comes with a much cost effective thing. Yeah. So you can see the coefficient of friction is much higher than the Poracode, which is your pinnacle, and the Gription has got even a higher coefficient of friction than even the TM augment. Although the porous size is bigger in the TM, the coefficient of friction is highest in the Gription cup. So this is an example of how a Gription cup can work very well. So this was a case that was done with it was a primary case. In my early days that I decided to do just a primary cup with that, and then that failed, and then I revised it to a Gription shell, and now this is the I think 12-year follow-up with the Gription shell, and it's worked extremely well. So that is the power of the Gription cup. And once you start using the Gription, which is with a high porosity, the host bone contact for success becomes less and less. So with the least amount of host bone contact, you can get a very good long-term success. So critical in revision surgery. So it's my go-to cup in revision surgery, and unless there is any specific indication like a dual mobility or something like that, I will always use a Gription cup. This we have covered. So here's a Peprowski one. Now, as I said, people say that the Peprowski one, you can get away with a standard cup. You probably will, but now we are talking about a very high success rate. So I think even when you're doing a revision, when the bone stock is not good, you must put in a Gription. Even if you're doing a Peprowski 1, you must put in a Gription highly porous shell. It's very important, I think. Choice is Gription. Here's another one, Peprowski 2, and I've revised with the Gription jumbo cup principle that I elaborated. Larger than the native size of the socket. That's what you mean by a Peprowski 2. Here again a Peprowski 2, again a Gription shell reconstruction. So we will discuss a little bit of augments. So here's a cavitatory bone loss, then we use a Gription shell, and then we put an augment like that. I have mixed and matched tantalum augments with Gription cup, no problem at all, no failures at all. So you can mix. If you want to use tantalum augment, that's fine, but you can use Gription augments as well. So here is an example of a cup with with a cavitatory bone loss or a type 1 or the classical mode. This is the classical mode, but the intracavitatory defect, a Gription shell with an augment that we've done, and the augment is a flying buttress mode, again a Gription shell. Here the augment is flipped over and put extra outside the cavity. Show you an example of a flying buttress mode augment. There's a flying buttress mode augment that we've done. But really I want to touch upon is that we have used many augment Griptions with the custom augment. We talked about it, I think. So this is what we developed, the custom columnar docking augment, which we developed quite some time ago. And all these augments we have now combined only with a Gription shell. And if you see at the diagram, if you see the diagram that comes from the company, that's the Gription shell, So it's been sort of made, the CCD augment has been made for the Gription shell. If you use any other shell, it is not made for that. So it is made for the Gription shell. That's very important. So that's how the case that looks like that, implant subtraction done on CT scan, and made for a Gription shell. So you get all these pictures. You can see how it's made for the Gription shell and how the augments will come. So custom augments, the columnar docking augment. This is at surgery. You can see that there is there, and you get the plastic model to play around with the thing. Put that augment. And unlike your off-the-shelf augments, the screw holes will fit exactly where you want. So very nice. It's a pleasure. And what I now do is, having done so many, I now drill I use a different drill bit, but I use the same drill. And before using any screw here, I'll put the screw on the plastic augment, right? Holding here, keeping it exactly in the orientation of the patient. Drill bit alone is different. I will drill and see, get a feel of. That is really learning, get a feel of it. And then I will drill the patient. It's really real-time training you get to get the screws, angles, where do you want to go, where do you want to avoid, where do you want to go, things like that. And you can see that we have done that, and that's the Gription shell. There's a trial of the Gription shell, and Gription shell has gone in. So all our CCD augments we have done with the Gription shell. And that's the post-op picture of the Gription shell and the CCD augment. And you can see that it's superimposed in the X-ray. It looks like this. So for all my jumbo type 2, as I said earlier, the jumbo cup reconstruction is for all your type 2 Peprowski. My go-to is a jumbo cup with the today jumbo cup Gription with the jumbo cup principle. When you go to 3, today it's a custom built augment. We don't use off the shelf augments anymore. As I said, it's cost neutral. So we go for custom augment with a Gription shell. That would be my go-to way of doing any Peprosky 3 defect today. That's where we stand. Thank you for your attention.